Welcome to our guide on bladder irrigation therapy. Ensure you have a medical order for bladder irrigations documented in the patient's notes. Before gathering supplies, double-spiked bladder irrigation giving set, urinary catheter drainage bag with hand bulb, 2 by 3,000 millilitres sodium chloride for irrigation bags, IV pole, bluey and alcohol wipes. The patient will need to have a 3-way IDC in situ. Ensure appropriate PPE. Position bluey under patient. Clean IDC ports with alcohol swabs. Ensure the catheter bag remains below the patient's bladder to prevent backflow. Close both clamps and connect the set to the irrigation fluid. Open only one clamp and prime the line. Once primed, close the clamp and connect the irrigation tubing to the 3-way catheter port. Open only one clamp and titrate the flow to a rosé to clear-coloured output. Monitor closely as irrigation bags will empty quickly and change as soon as finished. Irrigation should be continuous to prevent clotting and obstruction. Document on bladder irrigation chart when irrigation fluid is commenced and when the catheter is emptied. Empty the catheter when you start a new irrigation bag to make calculating the urine output easier. The urine output is measured as the difference between the input and the output. You can see on the example form that 3,000 millilitres of irrigation fluid has been started at 10:30. It finished at 12:30 and 3,100 millilitres was emptied out of the catheter. This means the urine output during this time was 100 millilitres. Urine outputs should be transcribed onto the fluid balance chart. Monitor for signs of bladder obstruction. These include reduced or no urine output, lower abdominal pain, urine bypassing the catheter, and restlessness or agitation. Irrigation sets can be left in place for 7 days. You may be required to deliver intermittent bladder irrigations. Swab the side port of the IDC tubing above the bulb with an alcohol swab. Prime an irrigation set. Connect to the side port. Keeping the IDC tubing below the patient's bladder, invert and elevate the bulb to ensure air enters the drainage bag and doesn't remain in the bulb as it is primed. Open the intermittent irrigation fluid clamp and prime the bulb. When fluid has filled the bulb and enters the tubing between the bulb and the drainage bag, clamp the irrigation fluid and tubing distal to the bulb. Gently squeeze the bulb for 5 seconds to irrigate the patient's bladder, stopping if the patient shows signs of discomfort. Unclamp the drainage bag. Watch for the bulb to re-inflate and irrigation fluid to drain into the bag. Repeat intermittent irrigation until the fluid drained is clear. Empty the IDC bag and restart the continuous irrigation. Manual bladder washout can be used to clear debris or clots blocking a catheter. It should not be used on patients who have undergone recent bladder surgery without a urology consult. Prepare equipment on the sterile field and don sterile gloves. Draw up saline, taking note of amount. Place drape over patient and using forceps, cleanse patient and IDC and 10 centimetres of the drainage bag. Place sterile container under drainage port of IDC. Disconnect drainage bag and discard. Connect 50 millilitre syringe and gently flush catheter and withdraw fluid. Empty into the non-sterile bowl. Repeat until fluid is clear. Connect clean drainage bag and document. Thank you for watching this guide on bladder irrigations. For further questions or support, refer to your device manual or consult your clinical team.